Welcome to Healthcare IT Today, where we explore the latest healthcare technology trends and discover valuable insights in health IT. I'm Colin Hung, and today we're going to examine the question, what's happening with staffing issues in healthcare? Sitting down with me today is Robbie Hughes, the founder and CEO of Lumeon. Robbie, welcome to the program.
Hey, Colin, great to be here. Thank you for having me.
So yeah, I mean, it's the number one topic right now in the news. It's certainly dominating the headlines from a healthcare perspective and the staffing challenges, whether that's clinicians, but also support staff as well. You know, as the CEO of Lumeon, what are you hearing around this issue from your clients?
Well, Colin, I'm lucky in that I get to spend a lot of time in Europe and I spend a lot of time in the States. And I've got to say, first of all, this is a universal issue. This isn't localized to one system or one state. This is something that is affecting healthcare providers everywhere. And it's as we know, it's multidimensional. On the one hand, we've got to be honest, we've been working our healthcare teams incredibly hard over the last couple of years, doing things in deeply unpleasant conditions and doing things that, as a society, we should be very, very grateful for. So that's one element. The other element is the job that they're being asked to do. It's not just more, but it's different. So it's no longer just seeing a patient in front of them. It's as much trying to coordinate people who frankly don't want to be coordinated, who don't want to come in, who don't want to go back and see and have their care delivered in the way that they used to because they're worried or they're concerned. Or so that's kind of the second part. And the third part is there's just a backlog of stuff that needs to get done that's been missed. And you put those three together to say nothing of any of the kind of the politicization of the vaccine and hesitancy and all that stuff. But if you just focus on those three issues, you've got a recipe for disaster that's really quite troubling for the healthcare environment.
Automation, obviously, is something that's near and dear to your heart, something that Lumeon does. You know, it has definitely got an impact on staffing. Isn't that right, Robbie?
That's right. So, I mean, a client who's deploying Lumeon will see somewhere between a 30 and our record so far is an 80% reduction in the cost. So that's mainly bodies of delivering care. And so that's a massive, massive change in how you think about what it takes to deliver, frankly, what can often be a higher standard of care, because you're making sure that the right things are happening deliberately, proactively, and purposefully for every single patient. But I think when you look at automation more broadly, people think about it in terms of, I've got this thing, I want it to happen 100% of the time. And there are areas within our industry where that works well. Revenue cycle is a great spot where people have really doubled down and focused on that kind of claims processing and all those pieces. And that's fine. And that's a useful way of saving a lot of time and effort. But that's not where the focus needs to be today. The focus needs to be today on making sure that our staff are operating at top of license, number one. And in order to do that, number two, we need to be eliminating the burdensome, repetitive things that are really getting in their way of, frankly, why they got into healthcare in the first place. And when you get into that problem, it gets very interesting because, yes, there are still those little repetitive bits that can be done, potentially on the follow-up side or on the documentation side. But the biggest opportunity really comes from how you think about what I would call the choreography of care.
Okay.
So how do you make sure that you're delivering exactly the right care for every patient and doing that on a patient-specific basis? Because if you can do that, what you'll tend to find is that actually you're doing too much, you're delivering too much. And so much of care today is delivered almost kind of remedially. In other words, we're catching up on stuff that we should have done proactively in the past. And so for me, when I think about automation in healthcare, it isn't about those ones and twos, those little bits that you can automate at the edges. It's how do you think about the process of care and how do you use technology to really amplify that so that you're standardizing at a level of quality and personalizing to the needs of the individual patient. And that, I think, is the big opportunity.
I love how you put that, Robbie, like the choreography of care, because multiple parties are involved. It's not a one single individual. So you really do have to get that coordination going. And I just really love how you put that. Is there a particular area that you think in within healthcare where automation can really make a big difference? You mentioned sort of this at the whole, at the high level, but is there anything sort of very specifically that you've seen automation make a big difference in?
Sure. I mean, the 80% reduction we did was in ophthalmology. It was around screening for glaucoma. We've done primary care work. We've done acute work. I will say right now, the biggest area of focus and demand we're getting from our customers is elective surgery recovery.
Mm.
You know, there's a backlog of patients who need to come in and have their operations, and these operations would have been driving the revenue engine of the health system. So how do you triage that backlog? How do you prioritize, and how do you make sure that your ORs are operating at full capacity? We found that using our orchestration platform to do this has been a hugely beneficial, um, has had a hugely beneficial impact. And particularly when you think about kind of the utilization of the care team, you think about what happens when a patient's coming in for surgery today. It's very kind of uh, it's very repetitive. It's like we're coming in, we're screening them, we're checking for these things, we're doing the H&P, we're ordering these tests, the results come back, fine. Maybe we refer them, maybe we don't. We do all these things, but it's done kind of serially, and it's done in this very repetitive way. When actually, and I think this is the really interesting misconception about the potential for automation. The job of the automation there is not to make sure that the same thing happens every time. We're not talking about factory medicine here. What we're talking about is using this personalization, what we call orchestration, to say, okay, this patient's come in before, we've seen them before, we've got their labs on file. In fact, we know that for the procedure they're coming in for, we've got enough of the labs to know that we don't need to order more labs. That's great. That means we don't have to schedule them in for a lab test. Okay, well, what's left? Well, now what's left is we need to start screening out these risk factors. Well, actually, again, we can look at their record and we can say we've already got that information. So again, what's left here? Well, we know that for this procedure, for a patient that looks like this and he's got this lab data, these are the 3 or 4 things that we need to focus on. 2 of which I can do digitally, 1 of which I can do with a phone call, and 1 I can wait till the day of surgery, which I can then do face to face. That's what I mean by the choreography of care. It's bringing all these things together and personalizing it, but doing all of that without a human having to lift a finger. And if you can do that, and again, the core of this is making sure you're focused on the individual needs of the patient. But if you can do that, we've seen in our studies this year, probably somewhere between a 60 and an 80% productivity lift from the care team there.
Well, it's a brilliant example, Robbie, because it sort of captures what you were talking about before in the fact that you don't have to order those extra tests, which is a burden on both the patient and the provider of care because you already got them. Like you've already got a history of those tests. So you just don't need to reorder them. So you're reducing costs overall for the health system.
Yeah.
And then for the patient, there's an impact there because if I don't have to have the test, that's one less procedure, that's one less thing I have to do before my surgery, right?
I don't have to come in. So this is where it gets really interesting. You know, we've talked about virtual care, we've talked about telemedicine, all this stuff. Well, the challenge today isn't kind of switching on Teams or Zoom and doing your consultations remotely. That's not the interesting problem. The interesting problem today is identifying whether a patient should or could be seen virtually, and if in fact that's the right thing to do. So again, you put all this together, and now what we're doing is we're weaving in virtual and physical care together seamlessly on a patient by patient basis. And that's the future of care. That's where we're going to get to. But again, it's not just about the one thing. It's not just about the consultation. It's everything around it. And how do we make sure that it all happens? And that's my focus. That's my passion. That's what we do as a company.
I read something on your blog that was saying there's a difference between, I'll call it surface automation or regular automation, and something you called deep automation. Can you maybe clarify what that is?
Yeah, so I can't claim credit for the term deep automation. That came from a client. But what we're getting at here is it's kind of this veneer of digitization that sits on top. So in the case of surface automation, what we're talking about is, I don't know, a notification going out to a patient, for example. We know that when the patient's got a visit coming up, we're going to notify them and make sure they turn up. It's kind of, this thing happens, we send that out, easy peasy. That's what I would call surface automation. What I've described to you, Colin, in this little story is how we're dynamically changing the process of care on a patient by patient basis. And that's kind of deeply weaving automation into the actual processes so that they're flexing and contracting in response to what's actually happening in real life. Because I mean, the one thing we know about every plan is that it doesn't survive contact with reality, and healthcare plans are the same. You know, we can say to the patient, come in, do this, etc. And, you know, as much as I would love for that to happen 100% of the time, it doesn't. So I think part of the challenge with deploying automation in healthcare is that if you rely on this construct where this is going to happen, then this, then this, then this, it's a little bit like reading a map. If you go out and you read a map and it says turn left, turn right, then to go 100 yards straight on, but you miss one of those, suddenly you're wildly off course. And that's the challenge with a lot of healthcare technology. We have systems that are very they're laid out like these maps where they're very instructive, but they're not dynamic. And really what we need is something a little bit more like Waze or Google Maps that replans as we go, like an air traffic control system. And that's, again, that's the way we think about the problem.
I mean, it's great because you're right. A lot of surface automation would be around, on day 5 after X happens, send this message or send this
But
piece of material. Hey, which is great, right? It's better
yeah,
than having a nurse manually do it. But you're right. It has no variability, right? It's always
yeah,
5 days. What if this patient needed it 2 days after because of certain other conditions? Or maybe
exactly.
they've already gotten it, right? Like you're
Well,
talking about
exactly.
automation.
How do we A, personalize it to the patient?
Mhm.
And then how do we B, personalize it to the circumstance such that if this other thing happens, whatever it might be, you know, good or bad, that we take account for that and we dynamically replan. And if I describe what Lumeon is at its very core, it's this dynamic care planning engine, and that's what makes all of this possible. Whether it's applied in surgery or inpatient rounding or discharge planning or care transitions or access, doesn't really matter to us. These are all viable use cases. But the core of it, the beauty of how this works, and the reason it works so well is that it can account for reality. And unfortunately, in our industry, you can't deploy automation if you're not able to do that, because then you end up with factory medicine. And should not try to deploy technology in areas where the job of the healer, where the care in healthcare is important.
Mm.
And so, for us, we're very much focused around these executional problems. We think there's a lot of runway there, and we think there's a lot of opportunity. But I'd be very nervous about going into areas where I think the bond between the provider of care and the patient is so kind of is foundational. And I see my job really as freeing up the care team, providers, nurses, clinicians of all types, to be able to do that. We want them doing that. That's what they got into it for, not this other stuff, not this nonsense that distracts them.
So, Robbie, if I was a CIO sitting across from you at a hospital, what would you say to me, or what would you recommend that I do to start thinking about more automation in my organization?
Well, I would, the first thing I do is I'd listen to my care team and I would try to find out where the pain is. And the reality is every system is different. There is no such thing as a prototypical healthcare system. So the first thing to do is to very much listen to the staff, listen to what's happening on the ground. And one thing that we do see this kind of across the board is there is a substantial difference between, actually, to be fair, this isn't a healthcare problem. This is an organizational structure problem.
Okay.
What happens on the ground versus what happens as reported through the organization can be very different things. So when we work with our partners on the ground, a lot of what we will do will be that baseline engagement, listening, and trying to work out what's going on. So I think that's the first step. The second step is to be open to the idea that there is a different way of doing things. And I appreciate that change is hard. I appreciate that culturally organizations will very much get into a way of this is how we do things. But I don't think we're at a place in the evolution of this industry today where we can say canonically this is the right way. And I think there's a huge diversity of opinion, but that creates an opportunity for evolution and differentiation if we can find the unique, the differentiated, and we can celebrate that. So I would say be very open to different ways of doing things. And I guess the final thing I would say is look at data. Try to analyze what you're doing and do it from a perspective of real evidence rather than someone's opinion. My opinion is no better than yours or anyone else's, and everyone's got a lens by which they look at their problem. Just because I see a problem and I see the solution being automation doesn't necessarily mean I'm right. As I said, there's a lot we can do with this, but it isn't everything. And so focusing on the problem, understanding what your staff are telling you, and then critically being very clear about what you're trying to measure and improve, that will tell you the answer. And if it's anything to do with efficiency, if it's anything to do with productivity, if it's anything to do with variability, those are the key areas where you can really deploy this stuff effectively. And then the benefit you'll see off the back of that will be improved engagement, improved retention, improved, frankly, joy at work from your staff. But be robust in your analysis and be robust in how you're thinking about it.
Robbie, we're right in the midst of conference season. I know there's a number of healthcare conferences that are coming up, both here in the United States and abroad. Is there anything exciting that you're going to be announcing or talking about at these conferences and from Lumeon's perspective?
Oh, we've got some super cool stuff happening. We'll be in Miami like everyone else in March. The timing of that is good. We've got some very interesting new capabilities coming to market, which we've been working on for the last 18 months. I think one of the interesting things about our business is that because we're so laser focused on this one problem around the orchestration, it exposes us to a problem set that many people don't see. So the things that we develop and the capabilities we're investing in are not sort of first generation type of optimizations. What we're investing in are industrial strength, kind of second and third order solutions to problems that I think others are going to start seeing in the market in 5-10 years time. So I'm super excited about it, but what that tells me is that doesn't necessarily mean that anyone else will be.
No, I'm excited for you. I'm looking forward to hearing what these will be.
Yeah, I mean, these are going to be transformative for our customers, and that's what matters. So
Awesome. Awesome. Robbie, where can people go to find out more information about Lumeon?
well, our website is www.lumeon.com. This podcast obviously is a great source of information. So anytime you want to learn anything, tune into this podcast. But I occasionally write stuff up on my LinkedIn profile. We've got some interesting pieces we put up there and things that I've taken the time to write. But frankly, we're blessed with a great team of people, both in the management team and the company, and around as advisors. So there's always good stuff, and good content that you'll see syndicated through our website. So,
Robbie, thank you so much for your time today. This has been a fun conversation. Really enjoyed having you.
thank you, Colin. It's a privilege to be here. Be well.
If you enjoyed this interview as much as I did, we'd love for you to subscribe, rate, and give us a review on iTunes, YouTube, or wherever you're listening and watching. Also, head on over to healthcareittoday.com where you can access free resources, industry news, and insightful articles. You can also connect with us on Twitter using the hashtag HITSM. I'm Colin Hung. Thanks for being here.